My name is Jose Pecero. My area of concentration in the MPA program is finance. Uh, my education is basically accounting and finance. My BA, so my bachelor degree is in finance. Um, this would be my fourth master's, and as soon as I take my comps, I'm going to continue with my PhD in business administration. My background is basically in the healthcare industry, supply chain, and I have been in supply chain for almost more than 30 years. Um, I am retired from Kaiser Permanente, and currently I work for as director or market area director of supply chain for LifePoint Health in Lake Havasu and Bullhead City. My my policy analysis has to do basically with acquiring capital equipment for or within the healthcare industry for for new hospitals, new clinics, or replacing the outdated staff that we have. But when it comes to analysis, you are very restricted, or the health industry is very restricted with funds. So we have to present a good case in order for the CEO or the CFO to release those funds, especially for a company that owns almost 100 hospitals in the whole United States. So you have to prioritize what you need to request, and you have to come up with some kind of cost benefit analysis in order to convince the CFO and the CEO that your project is more or is going to be more lucrative than other medical centers. For example, right now I'm in the process of requesting or analyzing the policy to request the purchase of 145 surgical beds, and I have to analyze to see how those beds are going to be paid off within the next 5 years. Might be that we discontinue the usage of disposable items. For example, in the healthcare industry, we use a lot of preventing measures to prevent injuries for patients, such as having bed alarms, so the nurses get alerted when a patient gets up to prevent injuries. Well, right now we can find beds or surgical beds that have the same mechanism, and my task is to analyze how I'm going to prevent the medical center from buying those bed alarms, so we can save enough money to buy the beds that need to be replaced. Thanks very much. My name is Jose Pecero. My area of concentration in the MPA program is finance. I'm an accountant, and this would be my fourth master's. And as soon as I finish this master's, I'm going to complete my PhD at Claremont Graduate University. My background is in supply chain within the healthcare industry. I have been in the healthcare industry for more than 30 years, probably 34. 30 of those years have been with Kaiser Permanente. I'm retired from Kaiser Permanente. Today, I'm the market area supply chain director for LifePoint Health in the Lake Havasu and Bullhead City area. When it comes to policy analysis, my area of concentration is in the private industry, in the healthcare. In the healthcare, the funds are very restrictive, and all the medical centers have to compete for the few resources available. And my existing company owns around 85 medical centers, and all of those medical centers are in need of replacing old equipment or acquiring new technologies. So my policy analysis is basically to secure funds, basically to do that, replace all equipment or purchase new technologies, or come up with ideas how those new technologies will be paid off. For example, might be that we request a new bed, and by purchasing new beds, we might eliminate like disposable items, such as bed alarms that we're using right now. And because the new bed technologies, they have part of the bed, they have incorporated bed alarms. So to prevent, well, not to prevent the patients from getting up, but to alarm when a patient gets up so the nurse can avoid those patients from having injuries. And that's most of my policy analysis perspective. I do not have experience in the public sector. My entire life has been working in the healthcare industry. Thank you very much.